I'll really quickly just say what's going on with the administration. It's, you know, they're off like a marathon sprint right now. Staffing up every day. We get calls from colleagues. I'm going to work in the administration. I'm doing this, I'm doing that. So heavily staffing up. They are being driven by the timeline. So they're being very methodical in terms of ticking off those early wins that I mentioned. We started off with a website called healthreform.gov. July 1st, it was transformed to healthcare.gov. This now has a clearinghouse of information and will serve as a clearinghouse for information in terms of plans and pricing. The Department of Health and Human Services is going through a pretty big reorganization itself. They've established a new office called the Office of Consumer Oversight and Information and Oversight Reform, headed by a former insurance commissioner, Jay Angoff, and it certainly will be active in terms of working on the exchange issues. CMS is reorganizing. That's the Center for Medicare and Medicaid Services. So we are fortunate to have had a recess appointment just the other day with Dr. Don Berwick, who is from IHI in Massachusetts, a pediatrician. And then we also, the person that we work most closely with is Cindy Mann, who heads up the Medicaid office. And then also I mentioned Tony Rogers. The implementation challenges are considerable for the administration. This is an enormous, enormous undertaking. We're talking, as I said, you know, payment changes, innovations, you know, state collaboration. The November elections are going to be very challenging because it will upset the apple cart for many states in terms of how they move forward with health reform. We have pending lawsuits from many states throughout the country right now. We have many states where they have potentially a Republican attorney general who is suing without the support of the governor. It's really messy out there. I will also say that the administration also has to contend with many unresolved issues. The biggest one I mentioned is FMAP. So states are in enormous trouble right now, including Illinois. We are finishing up. I see you shaking your head. I mean, because it's a world of pain. And right now, the enhanced support for Medicaid will expire at the end of the year. Congress hasn't gotten their act together to address this issue. NAPH is completely committed to this. We're having a huge lobby day with all of the hospital associations on July 15th. You got to get on the phone and you have to call your congressman and your governor to basically make the case to the feds that they have got to do this before they go home for the November elections.